Hello, and welcome to your supervisor training. In today's video, we will discuss supervision and IDP. BPPS will provide supervision to all employees according to licensure board standards and requirements of insurance companies of the clients we serve. This also includes Ohio Medicaid services provided by practitioners who under state licensing require supervision. BPPS requires supervision of all of its employees. The purpose of this policy and procedure is to ensure ViaQuest Psychiatric and Behavioral Solutions strives for excellence in meeting Ohio's licensing board requirements and accreditation standards regarding supervision and ensures all employees are competent to provide person-centered care for all clients. Contracted and non-full-time employees will receive work supervision at least once a month based on their credentials and needs. ViaQuest residential services that provide BPPS services will have at minimum weekly supervision. VRS team leads are required to do on-site supervision at least once a month for each program manager that they supervise in addition to their weekly supervisions. Now, there are multiple types of supervision. During this training, we're going to focus on two types: work and training supervision. Work supervision is required for all BPPS employees, regardless of licensure, and can be provided by any BPPS employee. Work supervision may occur through the supervisor's participation in treatments or service planning meetings, organizational employee meetings, side-by-side sessions with the client, or one-on-one meetings between the supervisor and employees. Work supervision needs are based on the individual and should be practiced as such. Some employees may require weekly sessions. BPPS standard of practice is for all employees, whether billable or non-billable, to have at the minimum supervision twice a month for at least 30 to 60 minutes. Now let's look at training supervision. Training supervision is to help clock the hours necessary to meet the requirements of independent licensure. Training supervision will be the employee's responsibility to ensure they are registered with the appropriate board as applicable and that they are receiving the right amount of supervision as identified by their licensure board. Training supervision is provided by persons qualified to provide this service as determined by the Counselor, Social Worker, Marriage and Family Therapist Board of Certification. It is both the supervisor and supervisee's responsibility to read their respective licensing board laws and rules for full understanding of their supervisory requirements. There are multiple types of supervision in addition to work and training supervision. Those would include general supervision, direct supervision, and even group supervision. Please refer to the full policy for definitions of each. Now let's discuss supervision agreement forms. Within 30 days of employment, a supervision agreement will be completed and updated anytime through employment for any new supervisor or position while employed. Each position will have a tailored agreement according to their position within their file. The next few slides will show the different agreement forms, as each one is tailored for specific disciplines. Please take the time to review the agreement form that pertains to your position and the employees that you will be supervising. The first form you see on your screen is for your nurse practitioners. Next is the form that nurses will utilize for their nursing supervision agreements. TBS will use the TBS supervision agreement form. This form will be utilized for TBS workers and VRS team leads. VRS team leads will complete a form with every VRS program manager that they supervise. Therapists will use the form that you see on your screen here, entitled the Therapist Work Supervision Agreements. And depending on the therapist's placement and licensure, It will determine if a trainee licensure supervision agreement form will be used. If a social worker or counselor is working towards their independent license, you will utilize this agreement form. For paid clinical supervision and paid training, please refer to policy and procedure titled Paid Clinical Supervision and Paid Training. All other positions will utilize the work supervision agreement to start the supervision relationship. Now let's discuss the individual development plan. The individual development plan, also known as the IDP, will be completed at the beginning of all supervision relationships between supervisor and supervisee, and it will be updated or reviewed at least annually. Within 90 days of employment, new hires and/or promoted employees will have created and reviewed an IDP with their supervisor. It is best practice to review the IDP with your supervisee quarterly. However, it must be reviewed and updated annually per policy. A new form will be developed with the employee's annual performance evaluation. To ensure TBS are meeting regulations, the TBS Individual Development Plan will be required for the first year of employment to ensure TBS are meeting basic competencies. This document here includes all the competencies that are required by the state of Ohio. Now let's look at the different supervision forms. But first, we must go over the requirements for each and every supervision session. So during your supervision, you must look at the accuracy of assessment and referral skills, the appropriateness of the treatment or service intervention selected relative to the specific needs of each client, treatment or service effectiveness as reflected by the client meeting goals identified in the person-centered plan, risk factors for suicide and other dangerous high-risk behaviors, issues of ethics, legal aspects of clinical practice, and professional standards, including boundaries, clinical documentation issues identified through ongoing compliance and quality records review, cultural competency issues, model fidelity when implementing evidence-based practices, and feedback to personnel that enhances their skills. VPBS provides formalized documents to ensure all areas of growth and regulations are being met. The next few slides will show the supervision forms specific to each discipline. This form here is for nurse practitioners, and it is tailored to their prescribing needs. The nurse's supervision form is tailored to nursing practices. So all nurses are responsible for knowing and practicing within the legal scope of practice, as stated of regulation of their RN or LPN decision-making model guide of their scope of practice. So all nurse supervision forms will be documented utilizing the first two forms that you see on your screen. If you are supervising a nursing team lead, you will complete all 3 pages. Licensed therapists and TBS positions, including VRS team leads, will utilize the therapy and TBS work supervision form. So VRS team leads will also use this form to document their supervision with program managers. And all other VPBS employees will have their supervision documented on the work supervision form. Now let's discuss the VPBS VRS integration program. VPBS team leads and VRS operations managers will use the VPBS VRS biweekly consultation form. Team leads will meet with their respective VRS operations manager at least twice a month and review each program manager that is assigned to them. In addition, VPBS management or designee will lead monthly collaboration meetings with VRS and VDES. Management will discuss client care and they will utilize the collaboration form. So the VRS team leads will complete the form during their monthly collaboration meeting. In addition to work supervision, standard of practice also includes having monthly group supervision or team meetings, which would add to the supervision umbrella. The supervisor will provide team meeting minutes that employees will have access to if they are unable to attend the meeting. Directors will generally provide topics to go over with all employees. Minimally monthly team meetings can include items like company updates, re-education, or even team building exercises. Lastly, let's discuss record and document retention. BPPS supervisors will retain supervision files of all employees who received work and/or training supervision. Depending on the director and/or their region, some supervisors will have physical binders, while some will create a folder on the OneDrive or SharePoint for each of their staff. Please coordinate with your director to know how supervision binders are to be maintained within your area. Regardless of if you have a physical binder or an electronic folder, they should all contain the following sections. The first one is the supervision agreement. The supervision agreement must be signed with the proposed dates and times for supervision to occur. Next, it must contain the individual development plan or the IDP. It must have the initial IDP as well as all updated and annual reviews. Next, we have caseload. You will want to keep a copy of the caseload report that was reviewed with your supervisee during supervision. As your supervisee's caseload changes, update and retain a copy as applicable. Next, you will want to have copies of all of their signed supervision forms. Keep in mind that it must have both the supervisee and the supervisor signatures on each form. Next is the compliance checklist. You'll want to maintain copies that are also sent to Human Resources. Keep track of any upcoming due dates, such as car insurance, any license renewal, even Aegis or maybe CPR and first aid. Policies. Keep hard copies of the policies signed by supervisees with the dates that they were reviewed. New hire training documents and any other human resources related documents must be kept within that section. Performance. You'll want to keep things like the performance evals, quality assurance reviews, surveys, audits, any emails regarding deadlines, outstanding deadlines, or upcoming trainings or items that would support any potential performance coaching. And lastly, we have here trainings and CEUs. So you will want to keep copies of any certificates of CEUs or any certificates from Reliance trainings that were completed. As a supervisor, you will sign off acknowledging that you have created a binder for each of your supervisees. Supervision documents must be turned in annually to Human Resources. This can be completed at the beginning of the calendar year or at the time of your supervisee's annual performance evaluation. In addition, upon the end of the supervision relationship, or if an employee is no longer employed with BioQuest, the supervision binder will be turned into HR. This concludes the supervision and IDP training. Thank you.